be doing your assessment today. Can you tell me your name and date of birth?
Jeff, June 29th, 1967.
Okay, thank you. Today I'm going to be performing a mental and neurological assessment to check different areas in the brain to make sure you don't have any lesions or tumors or anything like that. You do appear to be clean and well groomed, dressed appropriately. These are things that would give me a hint that you possibly could have some kind of mental alteration. Your speech appears to be clear and proper. First, I'm going to check your motor skills. What I'm going to have you do is put your knees together. This is a coordination of your fine motor skills. I'm going to have you tap on your knees like this, and then while you're tapping, go back and forth. Okay, very good. Next, I'm going to have you touch your thumb to each individual finger on both sides. Okay. Good. I'm not noticing any stiff or non-rhythmic movement, so that's good. These are testing your cerebellum. Next, can you go back? I'm going to have you touch your nose to my finger and then back to your nose. So nose, finger, good. I'm going to have you take the heel of your right foot, place it on your left shin, and just move up and down for me. Here we're testing the cerebellum. It's the area of the brain that's responsible for movement as well as other functions. Okay. Next, I'm going to check your equilibrium if I can have you stand up. All right. I'm going to give you a little push just so you're prepared. I'm checking your balance. Make sure you're steady on your feet. Okay, good. Now I'm going to do what's called the Romberg test. I'm going to have you stand, put your arms at your side, and close your eyes. I'm checking to see if there's any swaying motions back and forth. Again, this is checking your cerebellum to make sure you don't have cerebral ataxia or sensory loss. You can have a seat. I'm sorry, before you have a seat, if I can get you to walk to that doorway and then just turn around and walk back to me. And I'm going to notice that your heel is touching first. Turn around, and it goes to your toe, heel to toe. Again, this is checking any kind of sensory loss or cerebellum ataxia. You can have a seat, please. All right. Next, I'm going to check cognitive function. I'm going to put a couple of things in your hand. I'm going to have you tell me what they are. Close your eyes. Okay.
A key.
Okay, very good. And now I'm going to check what's called two-point discrimination. Tell me if you feel one or two objects poking your hand.
Two. One. Two. Two. One.
Okay. I'm going to do that up here as well.
One. Two. One.
Okay, same thing over here. Different areas of the body
One. Two.
have a different span. These are all checking to see if you have any parietal. You can open your eyes. Now I'm going to have you tell me how many things are poking you. I'm going to poke different areas. Close your eyes.
Two. 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 One. One.
Okay. Now if you can tell me what letter or number I am writing on your hand.
A.
Okay, we're going to do the other side. Again, we're checking for parietal lobe lesions.
8.
Very good. Okay. No sign of parietal lesions. Now I'm going to check your reflexes. If I can get you to take off your shoe for me. And I'm going to check what's called your plantar plantar reflex. If I could just have you put your feet straight up. Okay, and your feet do exactly what they're supposed to. We want them to move like that. It's called plantar flexion. And now I'm going to check your reflexes, your deep tendon reflexes. First I'm going to check here with this hammer. Okay. All right. Very good. And scoot back in the chair a little bit so your knee is hanging. Okay. One more thing. Since this shoe is off, I'm going to check what's called ankle clonus. And if you had that, your foot would tremor or shake when I did that. Okay, finally I'm going to check all 12 of your cranial nerves. These are nerves that are responsible for your sight, some of your tongue movement, your mouth movement, muscles in your face, and I'll explain each nerve as I go along. First I'm going to check cranial nerve number 1. This is your olfactory nerve, or your smelling. If you can close your eyes and smell and tell me what you smell.
A flower.
Very good. Next I'm going to check cranial nerve number 2. This has to do with your sight, your central and your peripheral sight. So if you can read that for me.
Reading fun in the sun.
Okay. And now I'm going to check your peripheral vision. Look at my nose and tell me when you see my hand wiggle.
You see it?
Okay. Keep looking at my nose, other side. Okay, next I'm going to check cranial nerve number 3, which is your ocular motor nerve. Number 4, which is your trochlear eye moves. And number 6, which is your abducens nerve. These all have to do with movement of your eyes, your accommodation of your pupils. So if you could just follow my fingers. Okay, and your muscles are good. And now I'm going to check. You see that your pupils are accommodating, and they are. I'm going to check your trigeminal nerve. This has to do with your forehead, your cheeks, and your jaws. I'm going to have you clench your teeth for me. Okay, undo and clench again. Okay, so that's the first 6 cranial nerves. I'm going to go on to cranial nerve number 7, which is your facial nerve. If you can smile for me, frown, puff your cheeks, scrunch your forehead. Okay. Cranial nerve number 8 is your acoustic nerve. If you can tell me when you hear something.
You hear it.
Okay.
You hear it.
All right. Next I'm going to check 9, 10, and 12. These are all going to be checked together. They have to do with your tongue, your gag reflex. Number 9 is your glossopharyngeal. Number 10 is your vagus, and number 12 is your hypoglossal nerve. Okay, so open wide for me. Stick your tongue out. Say ah.
Ah.
Okay, stick your tongue, move it back and forth for me. Okay, no deficits in any of your nerves so far. Next I'm going to go to cranial nerve number 11, which is your spinal accessory. If you can just shrug your shoulders for me and back down, shrug again, back down, turn your head to the left, to the right. Okay, you have no